Hi, welcome to WinsPharma, and today's topic is skeletal system. What is skeletal system? It composes of bones, which is made up of calcium and other elements. And how many bones are there in a body? 206 bones in an adult and 270 bones in a baby, and which fuse to form 206 by their age. Skeletal system is mainly divided into two major parts, that is axial bones and appendicular bones. What are axial bones? That is skull, vertebral column, thoracic cage, and appendicular bones. What are appendicular bones? Arms, legs, pelvis, shoulders. Next, coming to axial bones, we'll discuss about skull. Skull. Skull is the head, which is divided into two major parts, that is cranial bones and facial bones. Skull has 22 bones that are going to protect brain and give structure to the face. Cranial bones protect the brain and facial bones give structure to the face. And it is made up of, cranial bones are mainly made up of two parts, vault and base. Base are of three types, that are anterior cranial fossa, middle cranial fossa and posterior cranial fossa, and these three produce cranial cavity, and which is the house for brain. There are other cavities which are like ear cavity, orbit for eyes, nasal cavity for nose, and cranial bones are mainly 8 types. They are frontal bone, parietal bone, temporal bone, occipital bone, sphenoid bone, ethmoid bone. Two parietal bones and two temporal bones. Okay. Next, these temporal bones are flat and connected with sutures. These are connected with sutures. These bones are flat and these are connected with few sutures in skull. The line is called suture. The sutures have different names, like frontal and parietal bone. The joining between frontal and parietal is called coronal, and parietal and temporal is called squamous, and temporal and occipital is called occipitomastoid suture. And next, parietal and occipital lamnoid suture. There are foramina, that are holes that allows nerves, arteries, veins pass, and foramen magnum, which is hole for spinal cord. Then facial bones. Facial bones are 14 in number, that are nasal, mandible, lower jaw bone, maxillary, upper jaw bone, and face. Some of them are face. Then zygomatic cheekbones and vomer, palatine, lacrimal, inferior nasal cocha, that are 2. Then hyoid bone, which does not connect to any other bone, that is just below mandible. Okay. These are axial bones which is part of skull. Now coming to spine, that is vertebral column. Vertebral column also called as spine. These are irregular bones. What are these? These are irregular bones. These are divided into 5 sections based on their location. First is cervical vertebrae, C1 to C7, then thoracic vertebrae, T1 to T7, like this: cervical, thoracic, lumbar, sacrum, coccyx. Cervical vertebrae C1 to C7, thoracic vertebrae T1 to T12, lumbar vertebrae from L1 to L5, sacrum, it is a fusion of 5 bones, and the coccyx, that is tailbone. As we go down, spine gets larger, thin to large, and the ligaments which are present to hold the spine tightly are called anterior longitudinal ligament and posterior longitudinal ligament. And there are some intervertebral disc in between the vertebrae. Those are made up of elastic and lots of collagen, which absorb shock while we walk or run or like jump, etc. And now coming to structure of vertebrae. How the vertebrae is made up of? It is made up of body and vertebral arch. Vertebral arch which have two lamina and two pedicle that project the processes, and there are many processes. Vertebral foramen, spinal cord passes through it. We have foramen magnum where the hole for spinal cord, and vertebral foramen spinal cord passes through it. There are the processes like spinous processes too, transverse processes too, and superior and articular processes and inferior articular processes. Then coming to cervical vertebrae. Cervical vertebrae based on its location, it is top. It have spinous processes which is short, vertebral foramen which is large, transverse foramen accommodates arteries, transverse foramen which accommodates arteries. Thoracic vertebrae have long spinous process which point downwards. Demifascids connect to the ribs, which allow thoracic vertebrae demifascids to connect to the ribs. Lumbar vertebrae, they have pedicles and lamina which are short and thick. Next coming to thoracic cage. Thoracic cage consists of sternum, ribs, costal cartilage. Sternum is a flat bone which is in middle of our body and formed by fusion of three bones, that is manubrium, body and xiphenoid process. Then coming to ribs. There are 12 pair of ribs which project from vertebrae. There are mainly three types of ribs. They are true ribs, false ribs and floating ribs. True ribs are 1 to 7, false ribs are 8 to 12 and floating ribs are last one. These true ribs are nothing but these attach directly to the sternum. False ribs are do not attach directly. Longer going from 1 to 7. These are 1 to 7 which are longer. Shorter going 8 to 12. Next coming to what is floating ribs. These two ribs does not attach to the sternum. Appendicular system. Appendicular bones that consist of pectoral girdle. Pectoral girdle have two major bones that are clavicle and scapula. Clavicle is collar bone, scapula is shoulder blade. Clavicle has sternal end which these attach to the sternum to the part of manubrium. Then acromial end which attach to the scapula. Then scapula is a triangle, thin flat bone and it has three borders that are superior and vertebral and lateral. Vertebral is inner side, outer one is axillary or lateral side. Next, coming to upper limb. Upper limb you have humerus, and I will show you one diagram where the humerus parts are discussed. Next, the radius and ulna which are connected to each other by intraosseous membrane, and ulna is longer with olecranon and coronoid process. Radius is wide and thin. Then we have hand where we have carpals which are 8, which names scaphoid, lunate, triquantrum, pisiform, trapezium, trapezoid, capicate, hamate. Next, metacarpals which are 5 in number, 1, 2, 3, 4, 5, and proximal phalanges which are 5 in number, 1, 2, 3, 4, 5. Then middle phalanges is missing for the thumb, so we have only middle phalanges 4, and digital phalanges are number 5. Next, coming to pelvic girdle. Pelvic girdle which is less mobility but more stability, and it starts at sacrum, and this continue to form hip bone which have ilium, ischium and pubis. And lower limb, coming to lower limb have the largest bone, which is femurs. Femur has fovea captus, and fibula and tibula are connected to the same membrane, which is intraosseous membrane. And in the foot we have tarsus that are 7 in number. Biggest two, calcaneus and talus, which make ankle, and medial cuneiform and lateral cuneiform, intermediate cuneiform, navicular and cuboid. And metatarsals, which are 1 2 3 4 5 in number, same as in hand. And proximal phalanges, which are 5, middle phalanges, which are 4, and digital phalanges, which are 5. Now I have a question. Now find the word hallus. What is that mean? And comment me to let me know. Thank you for watching. This is all about skeletal system.